Thank you for having me today, and I would like to talk about, first of all, the situation for trans people in Europe, their living situations, and later I would connect that to the situation in the Netherlands and the approach that we have in Amsterdam to reach trans people, especially trans people of color and sex workers. As we all know, there has been an anti-gender movement going on. Poland is one of the main countries in the European Union where we see a lot of this rhetoric going on. Like a previous speaker said, we're very happy to see that the current government has been defeated in the election. And I hope, of course, that the situation will only improve. But we do see that other countries like Slovakia, who had elections a couple of weeks ago, are going the other way. We have Hungary, of course, as a very big example in the EU, where trans people are stripped from their rights, like this, with no concrete action from the European Union. We've seen also in Italy, not specifically the trans people, but for lesbian women, their children's birth certificates were retracted by the right-wing government there. So as we see, although a lot of us think that our rights are fundamentally protected by the European Union, we see that these rights can be taken away with a new election, with a new government, and that the European Union doesn't do enough to protect our fundamental rights. So this is something that we see over and over again, not just for the LGBT community, but also for women's rights, for example. And this is a quote from the Gate report, that the conservative movement is one of the main forces behind this anti-gender movement, especially from the USA, but also from Russia and from within the European Union. How the anti-gender movement started. In 2016, we had the bathroom bill in North Carolina, where trans people were forced to use the toilet. They were of the gender they were assigned at birth. Since then, there have been hundreds of laws proposed on a US state level. This year alone, there have been 583 laws proposed in the US states, and there have been 83 laws accepted. One of the most visible was, of course, Florida. We also saw Texas, where healthcare for trans children is taken away and the parents can get prosecuted. Here we have the map of the situation in Europe. As you see, the darker the color, the more rights trans people have. And you also see that it gets lighter the further east you go, but it doesn't always say everything. We also have some feedback from the difference in achievements between 2013 and 2023 on several key legislations and rights for trans people. And we see a small increase of countries that expanded the right of trans people in Europe. But since 2018, it has mostly been stalled, unfortunately. And in 2023, these are the countries that increased the right for trans people. So we have Spain and Finland, who adopted legal gender recognition based on self-determination. We have Greece and Spain, who introduced conversion therapy bans. Moldova made improvements. Albania made being trans a ground for asylum. And Kazakhstan was one of the first countries in Central Asia since 2020 that made it possible for trans people to get access to health again. Then we have the countries where it decreased. Slovakia, and with the election of the new government, it doesn't look good at all, because one of the parties is a hard-right party that introduced a bill in 2021 to ban the treatment of trans people. We have Spain, where although they did expand the legal gender recognition, but they failed to include children. And we have a couple of countries that still don't explicitly include trans people in their asylum protection law. Also in Europe, we still have 5 countries where there are no legal gender recognition or access to healthcare for trans people. These are of course, Hungary, Bulgaria, Slovakia since 2022, Azerbaijan, and Russia since this year. There are 3 countries where it's unclear. Those are Cyprus, Armenia, and Belarus. And 5 countries in Europe still require medical intervention or forced sterilization. Those are the Czech Republic, Latvia, Bosnia, Montenegro, and Georgia. Regarding the forced sterilization, we have Sweden and the Netherlands. They explicitly apologized to trans people for their past law regarding the forced sterilization of trans people. I think in Sweden it was 2018, and in the Netherlands it was 2021. And under those new laws, trans people got some compensation for the fact that they were forced to sterilize, to change their name and gender marker. I want to talk about the situation in the Netherlands now. In 2014, the law in the Netherlands changed. So you could have changed your sex and name on your birth certificate after you had a declaration from a doctor. There has been a review of this law, and in 2021 it was proposed that it will be by self-determination. In 2022 we had the debate, and until up now the law still hasn't been discussed. This is mainly because of the opposition from the right and center parties in the government, and also because there is going to be elections in November in the Netherlands. And we saw that there is a small but very well-financed group in the Netherlands who try to influence public opinion. They did this, for example, through a campaign, a poster campaign, all over the Netherlands. It's called Gender Doubt, they call themselves. And they use the safety of women and lately children to restrict the right of trans people. And a lot of people are very susceptible to that. And unfortunately, the government decided not to pass the law at the moment and wait until after the election to continue with the law. Also, the Netherlands still doesn't have sufficient specific legal protections against discrimination and hate speech for trans people. For example, under the constitution in the Netherlands, trans people are not seen as a group that can be discriminated against. And for example, if somebody puts something on Facebook about trans people in general, this cannot be prosecuted. I would like to talk about the Trans United Clinic. The Trans United Clinic is a collaboration between Trans United Europe and the Municipal Health Service in Amsterdam. We've been working together since 2021. The clinic itself was founded in 2018 by a group of trans people in the red light district in Amsterdam with ad hoc funding. And we hired a doctor, and all of the other people were volunteers. So it was peer-to-peer. All the doctor was trans, the nurse was trans, all the social workers were trans. And our main audience is people who don't have access to regular healthcare. So it's mostly trans people of color, migrants, and sex workers. the reason why we do this is because research of the Maastricht University has shown that trans women in general have 66 times more chance to acquire HIV, and trans men have 7 times more chance to acquire HIV in their lifetime. This is a global number. I think for Europe it's about 48 times more likely. To address the sexual health improvements, the Trans United Clinic was founded not only to provide healthcare specific to gender, but also to improve the sexual health of trans people. We take both gender care and sexual health into consideration because we see that a lot of our target audience is looking for gender care. For them, that at that point is the most important thing. The HIV care doesn't play a big role in their needs, because if you can't be yourself, you also don't care about your health that much. We take the being of yourself as one of the most important things into consideration in the Trans United Clinic, and that's why we offer a combination of gender care and STD care, HIV care, and HIV prevention through PrEP. Let me see. There's also the possibility to get HIV care, although in the last couple of years we didn't see any new infections in the community that we service. We did see people who already acquired HIV before they come to our clinic, before they come to the Netherlands, but there were no new HIV infections found during the work that we do as a clinic, and we have about 200 people in care at the moment, and we have a waiting list of another 200 people. Unfortunately, because due to funding, we had to stop taking new patients. So now patients have to wait at least 1 to 2 years to access healthcare. And that sounds like a lot, but in general, the waiting times in the Netherlands are 3 to 4 years to access gender healthcare at the general centers. And that's only for your first appointment, and then it takes another year before you can start hormones, another year to get surgery. So in most cases, we're talking about a procedure that takes about 6 years for people to get the care they need. At the Trans United Clinic, we have a holistic approach, and after 2 or 3 appointments, people can get access to hormones. So that's what we try to do. We are very restricted in the care that we offer because of the funding issue. But we do like to expand our services because we see there's a lot of demand for our services. And we see that by opening the Trans United Clinic, we reached a community that wasn't reached before, especially the trans migrant community, who was usually very invisible to the general healthcare providers. I think that also speaks to the great achievement that we in Amsterdam achieved already, the 95-95 goal. Last month there was a fast-track city conference in Amsterdam, and it was announced that there only been 9 new infections in Amsterdam. So we already achieved the goals that we were supposed to achieve in 2030. And I think initiatives like the Trans United Clinic helped to reach those difficult, hard-to-reach communities. And I think that we provided a big contribution to achieving the 95-95 goals like we did in Amsterdam.